Why are so many people leaving
The depth of the crisis in the NHS is so great that it is going to be tough, and we make no apology
Shadow
for being
Health Secretary Wes Streeting will say
What's that got to do with Wes Streeting?
Wes Streeting.
Wes Streeting is...
Health Secretary Wes Streeting.
Wes Streeting.
Let's talk to the Shadow Health Secretary Wes Streeting.
Wes Streeting. Wes Streeting, good morning to you.
Welcome back to another video, guys. Today I am actually in Liverpool at the Labour Party conference, and I'm really excited about today's interview. And actually it's a unique one. The Labour Party actually reached out to the good people at YouTube and helped us set up this interview with a truly formidable character, a gentleman who's on an upward trajectory, and many are tipping to be the future leader of the Labour Party and maybe even Prime Minister one day. So let's hear what he's got to say and let's get into it. Thank you so much for joining me on the channel.
No problem, and thanks for being here with us in Liverpool as well.
I know probably everybody watching this probably already knows who you are, but for those who don't, can you tell us who you are and what you do?
I'm Wes Streeting, I'm the Shadow Health and Social Care Secretary, which means if Labour wins the next general election, which we're working hard to do, it will be my job to try and grip the worst crisis in the history of the NHS, get it back on its feet and make sure it's fit for the future. I've been a Member of Parliament for 8 years now. I represent Ilford North, which is on the London-Essex border. Especially when I'm out of London, I always describe myself as an Essex MP because everyone else hates London. And, you know, I think like most people in this country, I love the NHS. It literally saved my life a couple of years ago when I went through kidney cancer. But I'm deeply anxious about its future. And I'm devastated about the state that it finds itself in today, where people simply can't get the care they need on time. And the people who are working in it are probably having the hardest time in their professional lives at the moment.
And I am a surgeon, so I know all about that, and I'm definitely going to ask you a bit more about that. But I want to know a little bit about you. Why did you go into politics in the first place?
Without sounding really schmaltzy, I still think, despite everything we've seen in the last 8 years, that I've been an MP. It's just a coincidence, by the way, the country went to the war after I became elected as an MP. I still think politics can be a force for good. I think when you look at the challenges in our country, particularly some of the deep inequalities and injustices in our society, there's no route to genuinely solving those problems in the long term that don't require good politics. And that's why I became an MP. I'm still not a very typical politician in lots of respects. I come from a very working class family in London's East End. I grew up on a council estate in a single parent family. We experienced poverty growing up, which I've written about and talked about a lot. Partly to show, by the way, we're not all the same. And, you know, to sort of take the NHS as an example, politics can't solve everything. And I'm not naive enough to think that simply electing a Labour government or having me in the Department of Health means I can wave a Labour magic wand and it's all going to be good. In fact, there's no way that government can solve the crisis in the NHS without working with and through and for the NHS workforce, working with partners that help to enable the NHS to hopefully be the best it can be, and also working with patients. I think one of the things I feel very strongly about is that we as patients need to be empowered to take greater control over our own health and care. And I want the NHS to be not just a national sickness service, but a genuine health service. And of course, if we're serious about promoting healthy life expectancy, we have to deal with the social determinants of health. So that's about good housing, good quality work, good quality education and skills and culture and media and sport and all of those other things that make life worth living. And if we have a, you know, as I think Keir Starmer will, a genuinely mission-driven government that sees that as its goal, pulling people together in partnership, then there's nothing that we can't do together.
Also, obviously I've been doing quite a lot of research, and I've watched some really, really interesting videos that you've been in recently, and I've looked at a lot that's been written about your book, which you called a memoir to growing up and getting on. What do you want people to take away from that book?
I tried really hard not to kind of pack the book with politics throughout the story, but I sort of unapologetically hit people on the nose at the end of it, because when I think about how it was that I went from Council House to House of Commons, there were lots of factors at play. I had a loving family, poor, and we had our challenges as a family, but I always had that love and support. And I think, again, without sounding too schmaltzy, we don't talk about the importance of love and care in politics. We always want to think about levers and policies, but there is something fundamental about people feeling loved and caring for each other. But there were other enablers. You know, I had a great state education with some amazing teachers in primary and secondary school who saw my potential and encouraged me to aim high and gave me the backing I needed to get on. We had the stability of a council flat, which when I was growing up, I must say, I thought it was a really awful place to live. We had problems with things like cockroaches. There were times when the electric meter ran out and the money had gone too. But when I compare my childhood and the poverty that I grew up in to kids growing up in my constituency today, how lucky I was, because my mum never had the fear of eviction. The rent was affordable, and that security of tenure meant that my mum had the extended family across the East End, and she was able to find work. I was able to go to the same schools. Now kids are growing up in temporary accommodation, being pushed from pillar to post. Kids are moving from school to school to school. No opportunity for teachers like mine to work their magic with the kids. And I've had cases in my constituency of families not just being moved from Ilford across London, but in more than one case now, I've had families move from Ilford to other parts of London and then on to Wolverhampton.
Wow.
And, you know, the breakdown that involves of family relationships, friendships, employment, schooling, community, that's why I genuinely think that things are worse today than they were in the 1980s. And I sort of, you know, I came of age in, you know, when I was, you know, was first involved in the Labour Party at a time when the mood music was literally things can only get better. And I sort of grew up with that sense of optimism of, you know, as Martin Luther King said, the arc of the moral universe is long, but it bends towards justice. And I'm trying to cling on to that sense of hope and possibility. But one thing that has definitely shaken me in terms of our modern political history is progress is not inevitable. You know, justice is not inevitable. Equality and fairness are not inevitable things. They have to be worked for and fought for. And it goes back to my kind of initial kind of schmaltziness about politics. It is still, at its best, the opportunity and the route to making things better.
And I think you really touched on a lot of my questions already, really, but we actually have a lot in common. Upbringing in the East London Council Estate.
Whereabouts?
Born and raised. Well, I was born at Mile End.
Oh, really? Where, in the Mile End Hospital?
Mile End Hospital.
Yeah, so was I.
Really?
Yeah.
Okay. And also you are obviously MP in Ilford, which is where my parents live.
Oh, wow.
So Redbridge is still a place that's dear to my heart. But we also have managed to transform our lives through education, and we're passionate advocates for widening access to university. How do you feel that your background has made you or prepared you for hopefully your role as Health Secretary?
So, one of the things that makes me excited about the potential for a Labour government if we win the next general election is, you see this reflected in some of the arguments we've been making, particularly Keir Starmer, when he said, I want to smash the class ceiling. Of all the things Keir said since he become leader, I was like, finally someone said it, because I thought the last Labour government was fantastic in so many respects, but one thing they did wrong, I think, was declare victory too soon when in terms of declaring a classless society. And I think there is still deep class inequality in this society. And one of the reasons Keir, I think, felt impassioned and determined to say that is you look at his own background, really humble beginnings. Dad was a toolmaker, mum was a nurse. In Angela Rainey, you've got someone who went through the University of Life and actually the School of Hard Knocks. She was a care worker who's worked her way up through the trade union movement to potentially being the next Deputy Prime Minister. Bridget Phillipson, who might be the next Education Secretary, like me and like you know, grew up experiencing poverty in a, you know, working class family, in her case in the North East. You got me. And that perspective and experience, lived experience, gives you a different outlook that I think leads you to different conclusions, because even taking into account some of the things I saw in Manchester at the Conservative Party conference last week, which I'll put to one side, trying to be positive for a moment, I've always taken the view that the reason the Conservatives make bad choices isn't because they're bad people, it's because too many of them don't know what life is like for a lot of people in this country.
Yeah.
And if they did, they would make different choices, and they wouldn't make choices that have increased child poverty, that have neglected the cost of living crisis, that gives you all the reasons why, you know, oh, you can't abolish the non-dom tax status for the non-doms, oh dear, and as for those private equity fund managers, oh, you can't close the loophole, and VAT on private school fees, oh no, not an attack on aspiration, and, you know, but when it comes to the taxes of people on low and middle incomes, well, they didn't hesitate to knock those up. When it came to cutting 20 quid from universal credit, I could literally nick 20 quid a day from Rishi Sunak's wallet, and I genuinely don't think he would notice. And that doesn't make them bad people, but it does lead to bad conclusions. And so one of the things that excites me is the idea that around the cabinet table, you will have people who have experienced life at the sharp end and haven't forgotten our roots. And that, I think, is an exciting possibility for tackling the burning injustices in our society.
Wes, I want to get into some nitty gritty on the NHS, if you don't mind.
Yeah, definitely.
Shall we have a sit down?
Yeah. Oh God. How bad is this grilling going to be?
Well, I've kept you standing. I've got a whole crew here in the background.
Yeah, they're my minders to make sure I don't say anything that gets me the sack. Pressure's on now.
So the NHS staff at the moment feel deeply let down.
Yeah.
We've gone through successive governments with false promises. We went through a decade of austerity. We went through what feels like economic strangulation. I can tell you on the inside, it really feels bad. It feels almost intentional. What makes this Labour Party different, and you potentially as health sector, what makes it different to what we've heard for the last decade or more?
I think it starts with a really brutally honest assessment of how bad things are. And I've kind of caused some controversy in the last year by coming out with some things that are considered heresy, and particularly in some parts of the Labour Party. You know, the NHS is not the envy of the world. It's a service, not a shrine. And it's not just on its knees, it's on its face, I think was Keir's phrase. And the reason I've been so brutally honest is I want people working in the NHS and people who use the NHS to be reassured that we've noticed and we've heard what they've said. And people have sort of said to me, oh no, you can't go around saying that, you know, it's really unfair on the staff. I'm like, I'm telling you what the staff are telling me. They don't want rose-tinted nostalgia for a better yesterday. They want people who are being honest about where we are today and determined to work to build a better future.
Where did it go wrong then? Where do you think it went wrong?
I think of quite a number of things. Massive top-down reorganisation by Andrew Lansley, which cost billions of pounds and caused untold disruption, and not only failed to make things better, it actively made things worse.
You can wait like people are waiting for a bed now. And when it goes private, no, I've had enough of you. I've had enough of you and Cameron.
I'm very sorry.
Are you going to go home?
Because the NHS is not for sale. There's no privatisation.
Oh, God, what have you been privatising since 1979? Don't you dare lie to me.
79? No.
You're not going. They're not letting you go. No.
The lack of proper workforce planning, which has left the NHS, you know, hugely understaffed. So you've got the situation where poor old GPs pick up their newspaper every day and sort of see, you know, the complaints about people not being able to get access. Yet they're delivering more than 1 million appointments there were pre-pandemic. The problem isn't a lack of work, it's a lack of doctors. So lack of proper workforce planning, I think, has been a big part of it. Also, I think part of the challenge of worshipping the NHS as a national religion is sometimes you're too afraid to actually say the things that need to be said about what's holding it back. And when I've looked at other healthcare systems, the reason they're better than the NHS isn't because they're funded differently. It's got nothing to do with insurance systems or anything like that. And I will always, defend till I die an NHS that's free at the point of use, a public service. But when it comes to spending on hospitals, we're pretty much nearly top of the table. But when it comes to primary care, community services, mental health, social care, we're either near the bottom, at the bottom, or seriously lagging behind. So we've got a late stage diagnosis and treatment model in our country, not a model that's geared towards early diagnosis, faster treatment, better for patients, better value for taxpayers' money. and even more importantly, a public health system and a public health philosophy and approach as a society that drives towards the promotion of good health and the prevention of ill health. So if we see those big shifts from hospital to community, from analog to digital, from sickness to prevention, if we harness the revolution that's taking place in life sciences and technology, where this country is a global leader, you combine that innovation with the remarkable people we have in the NHS and a societal approach that focuses on prevention, and my goodness, the sky's the limit. There's nothing that the NHS would not be able to do.
You know, that all is part of the NHS long-term plan to drive majority of care, or as much as we can, into the community, to create a healthier population, because we know that chronic diseases are a huge burden for NHS, diabetes, obesity, smoking, heart disease. So if we can create a healthier population, and that'll help, and harnessing technology, I think there's a huge amount being spent on hopefully developing virtual services so that actually we can keep more people out of hospital.
Yeah, home, yeah.
But, call me a cynic. I've been in the NHS, including my time at med school, for almost 20 years now.
Yeah.
And from my own personal professional network, I've seen some fantastic doctors, like really brilliant minds, really capable people I admire and emulate and look and hope to be like, leaving.
Yeah.
I'm talking about some of the best surgeons I've worked with, packed their bags and they've gone to New Zealand, Australia, Canada, the US, UAE, Nigeria, India, like the list goes on. And every day I'm finding more and more of my colleagues or previous classmates who have left.
Yeah, I'm worried I'm going to have to run a black ops operation in Australia on TikTok and Instagram with huge spiders and snakes saying, oh, you don't want to go and work there.
We need to bring them back. But I think, so for me, on the inside, I think the biggest issue that we're facing at the moment is morale in staff. Any ideas on how we might tackle or address that?
Yeah, so a few things. One is, got to see an end to the strikes. And when I've spoken to the BMA, I think, of course, pay is part of it, particularly for junior doctors. I think consultants would acknowledge that they are relatively well paid compared to other parts of the NHS and wider society. Not to say they're not making a fair point, by the way, about their pay not keeping up with
they might
inflation.
disagree with you there, but
they'll give you a long list of, feel free to disagree as well, but I was struck by the long list of things that consultants raised about their working practices and working environment, which if we addressed means they wouldn't be out on strike. With the junior doctors, the nurses, AHPs, it's about pay, but it's also about the wider working conditions. So I think the government's got to negotiate seriously, treat people with respect to bring an end to the strikes. But more than that, I think if we win the general election, I want to do something quite revolutionary for a politician, which is to win power in order to give it away. And it goes back to the point I made a bit earlier, which is the way we build an NHS fit for the future isn't by just having one right politician behind one desk in the Department of Health. It is about working with and through the people who make the NHS and have made the NHS for the last 75 years one of our country's most loved institutions, and that's the people who work in it. And so, I listened to Matthew Taylor from NHS Confederation say something yesterday, which I was really struck by, which is, every kind of tier of the NHS, and there are arguably too many tiers, but every tier of the NHS has got to think, how do I empower the next tier down? Not how do I pull accountability up? How do I control and dictate what the next layer down is? How do I empower that team to do more? Because the thing that gives me probably most hope about the future is when I think about those three shifts I want to see in terms of, community, digital, and prevention. There are already examples of what that future looks like being done by creative people on the front line. And that's what gives me the conviction there's nothing wrong with the NHS that can't be fixed by what's right with the NHS. And that's why we've got to encourage innovation, push for more clinical leadership.
Yeah.
And give people a bit more freedom and agency to solve problems, because again, we've got some of the smartest minds working in the NHS. It is really hard to get into medical schools. Doctors are very clever people, and don't you love telling me? And they're all motivated really by the same thing, which is wanting to do the best by their patients. So let's take that as our starting point, give people a bit more trust, a bit more agency and more power. Goes for patients too, by the way. I think we deserve more power and more agency and control over our own healthcare. And if we create that kind of culture, the sky's the limit in terms of the potential of the NHS. But I appreciate that is a far cry from where we are today. And on every single one of those things, take digital, for example. Forget genomics and AI and machine learning. People would be happy just to turn up and find the computer turning on or not freezing when you've got your multiple applications open to deal with one single case sat in front of you. So I appreciate things are hard. I'm not rose-tinted either about where we are today or how hard it will be to, and how long it will take to get the NHS to where we want it to be. But I hope people take reassurance from that honesty and hard-headedness. That we're not naive. We know it's going to take time. We're not going to expect overnight transformation, and we really want to work with people in that spirit of partnership and trust.
And one more question.
Taskmaster.
Okay, well, we started a little bit late. Let's see. Can I ask 2 more questions?
Yeah.
So I want to know a little bit about your Fit for the Future fund.
Yep.
In a nutshell, what do you want people to know about it? How is that going to change? Because we've heard, as I said, promises over the years. You talked about extra scanners. I think a lot of doctors are a bit sceptical because we know if we double the amount of scanners, we still are losing doctors. We need doctors to interpret the scans, to operate the machines. So what's the crux of the Fit for the Future fund?
I mean, we just don't have the diagnostic capacity that we need, and that's what's part of what's driving late diagnosis and wasting lives, bluntly, and also wasting money. So by doubling the number of CT and MRI scanners, and not just doubling in terms of the number, but improving in terms of the quality, we can actually drive up productivity in the NHS because these machines can process scans 35% faster than some of the dated kit we've got in the NHS today. It means we can get more people through. I appreciate the point about the bottlenecks, and one of the things we're looking at in terms of sort of workforce planning is making sure we've got the right capacity in place. I think there are huge possibilities actually in terms of what we're seeing coming down the track pretty fast now on AI and machine learning for the interpretation of scans. I think we'll probably always want a pair of human eyes on it, but whether we'll need as many eyes as we currently have on scans, I think there's real productivity gains to be had here. So I think for patients and for staff, there is that kind of exciting possibility of being able to do what we all want to do, which is to get people diagnosed faster on a treatment pathway much more quickly, which means better outcomes for patients, better value for taxpayers' money.
Okay, and my last question is, maybe somebody's watching this and maybe sometime in the future you could be the leader of the Labour Party, as people are mentioning, and potentially even the future Prime Minister. But what do you want your legacy as, hopefully, the Secretary of Health to be?
I would like to, on my deathbed, which I hope is some decades away, I would like to look back on this stage of my life, and I hope we will win the next general election. We're not taking people or votes for granted, and there's a lot of work for us to do. I would love to be able to look back on that time, if I'm lucky enough to be the Health and Social Care Secretary, and be able to say that with the work that we did together, we took the NHS from its worst crisis in history and made the right long-term decisions so it's there for us for the next 75 years and beyond. And if the only thing I ever achieve in my life would be to deliver that 10-year plan for health and social care that we need, and to give people their hope back and their NHS back, I will die a very happy man. I will look back on that as a life well lived, and I hope that in the fullness of time, you know, people say, yeah, that period when things look really bad, we had the right team in place to turn it around. And that's not simply about me. I can't do this alone, and politics can't solve every problem. It is about me enabling a whole team of people to get the NHS back on its feet and fit for the future.
Brilliant. Thank you so much, Wes.
Thanks for having me.
I've been told that's all I'm allowed to ask. So I'm sure you've got a lot
Yeah, I'm
to
sorry,
do
that's
today.
my fault for being late.
You've got a speech coming up now, I think, right?
Yeah, I'm speaking at a lot of events this week. My conference speech is on Wednesday, and I have the unenviable task of trying to delete about 1,000 words for it to bring it into what a kind of a remotely acceptable length of time. So if you've got any ideas on brutal editing, you know, give me a shout.
Thank you so much. Thank you for watching this video all the way to the end. Hopefully you took something away from it. As you can see, I am at the Labour Party conference, and look how many people came to hear this man speak. So thank you to the Labour Party for making this interview possible. Please let me know what you thought in the comments, and as always, subscribe, and I will see you in the next one.